What if one phone call changed everything? Imagine this. Your mother, 72 years old, calls you from a clinic waiting room and says, "They want to give me this vaccine and I just want to check with you first." And when she tells you which one it is, your stomach drops because you know something the nurse in that room doesn't seem to be considering. That moment, that 5-minute phone call, is exactly why we made this video today. Because if a situation like that can happen to someone whose family includes a doctor, how many other parents and grandparents are sitting in those same waiting rooms right now, rolling up their sleeves, trusting completely without anyone asking a single question on their behalf? If you're new here, welcome to Health is Golden, where we cover the health information that actually matters, explained clearly, without the jargon. Hit subscribe right now and turn on notifications so you never miss a video that could protect someone you love. Before we go any further, let us be very clear about where we stand. We are not anti-vaccine. We want you to hear that clearly. We are not anti-vaccine. Vaccines have saved millions and millions of lives throughout human history, and they continue to do so. We believe in the power of immunization. Full stop. But here is what we also believe. Not every vaccine is appropriate for every person at every age. And once you cross that 60-year threshold, your body is playing by a different set of rules. Your immune system is not what it was at 30 or even 50. Your organs are processing things differently. Your risk profile has shifted. And some vaccines that are perfectly fine for a younger person can become genuinely problematic for someone in their 60s, 70s, or 80s. That is not fear-mongering. That is just medicine. That is just science. That is just paying attention. So today we are going to walk you through 5 specific vaccines that many physicians, as doctors and as family members, would never let their own parents receive after the age of 60. Some of these are going to surprise you. Some of these are vaccines that are routinely offered to older adults in clinics and pharmacies across the country. By the end of this video, you are going to understand exactly why and what alternatives might actually serve your parents or grandparents much better. Vaccine number 1, the live attenuated influenza vaccine, FluMist. This is the one that almost got the mother we mentioned at the start of this video, and it might be the most important one on this list because it is so widely offered without proper screening. You might know this vaccine by its brand name, FluMist. It is the nasal spray version of the flu vaccine, and a lot of people actually prefer it because there is no needle involved. You just spray it up your nose and you are done. Sounds easy, sounds painless, sounds great. But here is what most people do not realize. FluMist contains a live virus. It is weakened, attenuated, but it is still alive. For a young, healthy person with a robust immune system, that weakened virus is no problem at all. Their body sees it, learns from it, builds antibodies, and moves on. But for someone over 60, the picture is very different. The FDA already states this vaccine is not approved for anyone over 49, and yet it has been offered to older adults, sometimes without anyone asking their age or properly screening them. Here's why that matters. The immune system at that age is already declining through a process called immunosenescence, meaning the body's defense system is slower, weaker, and less precise. Introducing a live pathogen into that environment is like sending a weakened opponent into a boxing ring with a fighter who can barely keep their gloves up. It is not a fair fight, and the outcome can go sideways fast. There are excellent inactivated flu vaccines specifically designed for older adults. The high-dose flu vaccine and the adjuvanted flu vaccine, formulated to give an aging immune system the extra boost it needs without the risk of introducing a live virus. So if your parent is over 60 and someone offers them the nasal spray flu vaccine, say no. Ask for the high-dose or adjuvanted version instead. Did you know FluMist was not approved for anyone over 49? Drop a comment below. Type yes if this surprised you. We read every single comment on this channel. Vaccine number 2, Zostavax, the old shingles vaccine. This one is going to raise some eyebrows, especially if your parent received a shingles vaccine several years ago. If they got the shingles vaccine sometime before around 2020, there is a chance they received Zostavax. And here is the issue. Zostavax was also a live vaccine. It contained a live weakened form of the varicella zoster virus, the same virus that causes chickenpox and later in life can reactivate as shingles. For years, it was the only shingles vaccine available. So doctors gave it because it was better than nothing. But the problems with Zostavax in older adults were significant. First, its effectiveness dropped off dramatically in people over 70. Studies showed its efficacy in people over 80 was only around 18%. That is barely doing anything. And because it was a live vaccine, it carried the same risks we just discussed with flu mist. In people with weakened immune systems, and many people over 60 have conditions or take medications that suppress their immunity, a live vaccine can potentially cause the very disease it is supposed to prevent. There were documented cases of people developing shingles-like rashes and complications after receiving Zostavax. Here's the good news. Zostavax has been discontinued in the United States and many other countries. It has been replaced by Shingrix, a recombinant, non-live vaccine that is dramatically more effective. Shingrix has over 90% efficacy even in adults over 70. It does not contain a live virus. It works through a completely different mechanism. It is genuinely one of the best vaccines developed for older adults. So if your parent has not gotten the shingles vaccine yet, make sure they get Shingrix, not the old Zostavax. And if they received Zostavax years ago, talk to their doctor about getting Shingrix now. The protection from Zostavax has very likely faded. This matters enormously. Shingles is not just a rash. It can cause debilitating nerve pain that lasts for months or years. It can affect the eyes and cause vision loss. In older adults, it can be absolutely devastating. So yes, get the shingles vaccine, just make sure it is the right one. This is exactly the kind of information that never gets explained properly at a routine appointment. Share this video on Facebook right now and tag a family member who has aging parents. You might be protecting someone without even realizing it. Vaccine number 3, the yellow fever vaccine. We know what some of you are thinking. My parents are not planning a trip to the Amazon rainforest. Why would this even come up? And you are right that for most people over 60, this vaccine is not part of routine care, but here is where it becomes very relevant. Retirement travel is huge right now. More and more older adults are visiting South America, Sub-Saharan Africa, and Southeast Asia. And many of these destinations require or strongly recommend the yellow fever vaccine before entry. So your 70-year-old father decides he wants to take that bucket list trip to Brazil or Kenya. He walks into a travel clinic and they tell him he needs the yellow fever vaccine. Here's what concerns us deeply. The yellow fever vaccine is one of the most effective vaccines ever created, but it is also a live vaccine, and it carries one of the highest risk profiles of any vaccine currently available for older adults. The CDC itself acknowledges that people over 60 have a significantly increased risk of serious adverse events from the yellow fever vaccine. There is a condition called yellow fever vaccine-associated viscerotropic disease. Essentially, the weakened vaccine virus can overwhelm the body and cause a systemic infection that mimics actual yellow fever. It can affect the liver, the kidneys, and the cardiovascular system. The mortality rate for this condition is extremely high. Somewhere around 60% of people who develop it do not survive. Now, to be fair, this is rare. It does not happen to every older person who gets the vaccine, but the risk increases substantially with age, and even more so if the person has any underlying health conditions, which most people over 60 do. If your parent absolutely must travel to a yellow fever endemic area, have a serious conversation with their doctor about whether the risk of the vaccine outweighs the risk of the disease. In some cases, a medical waiver can be obtained. Missing a vacation is a far better outcome than a life-threatening vaccine reaction. We're halfway through this list, and if this is giving you information you didn't have before, hit the like button right now. It costs you nothing, and it helps us reach more families who need to see this. Vaccine number 4, the oral typhoid vaccine, or Vivotif. By now, you may be noticing a pattern in this video, and you would be right. The common thread running through almost every vaccine on this list is the same: live vaccines in older adults. The oral typhoid vaccine, sold under the brand name Vivotif, is another one that typically comes up in the context of travel medicine. If your parent is planning to visit parts of South Asia, Africa, or Central or South America, they might be offered typhoid protection. And there are 2 types available: an injectable version using an inactivated form of the bacteria, and the oral version, Vivotif, which contains a live attenuated strain of Salmonella typhi. For an older adult whose immune system is already declining, who may be on immunosuppressive medications for conditions like rheumatoid arthritis or inflammatory bowel disease, or who may have diabetes, heart disease, or kidney problems, a live oral vaccine can be risky. The oral typhoid vaccine can cause gastrointestinal symptoms that are more pronounced in older adults. It can interact with antibiotics and other medications that older adults commonly take. And its efficacy in older populations has not been as thoroughly studied as we would like. The injectable typhoid vaccine does not carry the same risk associated with a live organism. So if your parent needs typhoid protection for travel, ask for the shot and not the capsules. It is a simple switch that can make a meaningful safety difference. And beyond that one switch, have a broader conversation with their travel medicine provider about every vaccine being recommended. Ask whether each one is truly appropriate for someone of their age and health status. Your parent deserves personalized medical care, not a one-size-fits-all approach. Vaccine number 5, the BCG vaccine. We want to be very thoughtful with this final one because it is the most nuanced on the list. BCG stands for Bacillus calmette-guerin, and it is a vaccine primarily used against tuberculosis. In the United States and many Western countries, BCG is not part of the routine vaccination schedule, but in many parts of the world, it is given at birth or in childhood. And there are situations where an older adult might be considered for it. For example, if they are traveling to a high tuberculosis burden country for an extended period, or in rare cases where BCG has been explored for other uses, including bladder cancer treatment and research into its effects on the aging immune system. Here is the concern. BCG is a live vaccine using a live attenuated strain of Mycobacterium bovis. In an older adult, particularly one with any degree of immune compromise, BCG can cause serious complications. There have been documented cases of disseminated BCG infection, where the bacteria from the vaccine spreads throughout the body. This is rare in young, healthy individuals, but becomes a real concern in older or immunocompromised patients. Symptoms can include persistent fever, weight loss, and infections across multiple organ systems. Treatment requires months of anti-tuberculosis medications, which themselves carry significant side effects, especially for aging kidneys and livers. In virtually every scenario, BCG vaccination after the age of 60 is something to approach with great caution and thorough discussion with a physician. If tuberculosis protection is a concern, there are other strategies: preventive medications, exposure reduction, and risk management approaches that do not involve introducing a live bacterium into an aging body. Did any of these 5 vaccines surprise you? Drop a comment and tell us which one. We genuinely want to hear from you. Your response helps us create more content that matters to our community. Why? This topic matters and what we do recommend. We live in a time where there is a lot of noise around vaccines. There are people on one extreme who say all vaccines are dangerous and no one should get any of them. And then there are people on the other extreme who say every vaccine is perfectly safe for everyone and you should never question your doctor. Both of those positions are wrong. The truth, as it usually does, lives somewhere in the middle. Vaccines are one of the greatest achievements of modern medicine. Full stop. But like any medical intervention, they need to be applied with wisdom, with nuance, and with an understanding of the individual patient. And when that patient is over 60, the calculation changes. Everything we have talked about today comes down to one fundamental principle. As we age, our immune systems change, and our medical care needs to change with them. We also want to address something some of you may be feeling right now. If your parent already received one of the vaccines on this list, please do not feel guilty. Medicine is always evolving. What we knew 10 years ago is not what we know today. The fact that you are watching this video means you care. And going forward, you are now equipped to have better, more informed conversations with your parents' doctors. That is all any of us can do. Now, because we do not want to leave you with the impression that older adults should avoid vaccines altogether, here is what we enthusiastically recommend for people over 60. The high-dose or adjuvanted flu vaccine every year is critical. Influenza kills tens of thousands of older adults every single year, and the right flu vaccine can be life-saving. Shingrix, the recombinant shingles vaccine, is outstanding. Every adult over 50 should get it. The pneumococcal vaccines, which protect against pneumonia and related infections, are vitally important for older adults. Updated COVID vaccines continue to be recommended for older and high-risk populations. And the TDAP booster, protecting against tetanus, diphtheria, and pertussis, remains important throughout life. These vaccines are safe, effective, and specifically designed or approved for older adults. They use inactivated or recombinant technology. They have strong safety data in older populations, and they protect against diseases that disproportionately affect and kill older people. Please make sure your parents are up to date on every one of them. The message of today is not to avoid vaccines. The message is to choose the right vaccines. One more thing before we close. When a vaccine is being recommended for your parent, you have every right and every reason to ask questions. Ask which specific product is being used. Ask if it is a live vaccine or an inactivated one. Ask about the specific risks for someone of their age and health history. Ask about alternatives. These are not rude questions. These are not difficult questions. These are exactly the kinds of questions that good doctors welcome because they show that you are engaged and that you care about making the right decision. And here is something worth remembering. A good physician will take the time to explain why they are recommending what they are recommending. They will walk you through the risks and the benefits. They will respect your right to be informed. If they do not, it might be time to find a different provider. Your parents are counting on you, even if they never say it out loud. Here's what we need you to do right now. 3 things. 1, drop a comment below and tell us, did your parents ever receive any of the vaccines on this list? Or is there a vaccine question you have been wanting to ask? Leave it below. Every comment get read and we want to hear from you. 2, share this video on Facebook right now and tag someone with aging parents, a sibling, a friend, a cousin. Send it directly to your mom or dad if you can. Information like this has the power to protect people, but only if it reaches them. You have the power to make that happen right now. 3, subscribe to Health is Golden and turn on your notifications. We post new videos every week, the health topics that matter most to older adults and their families, explained clearly and without an agenda. Your family deserves that kind of attention. This is Health is Golden. Ask questions, stay informed, and take care of the people you love.